Judge Clay Jenkins, man. I appreciate you sitting down with me.
Derek, glad to do it. It's always great to see you.
Man, there's a lot going on in the world right now.
Well, there's a lot going on, but you and your family are a testament that we can overcome and be blessed in things. Seeing you and seeing Amber and the children, and thinking where we've been over the last 5 years with the Ebola crisis, it just really shows that this community, as your family has, can move from fear to faith, can move from panic to prayer.
Absolutely.
And that we can, move from selfishness to sacrifice, as we've seen so many people do already. My advice to people is just exhibit that personal responsibility. We need your help right now. If you're a young person and you're still going to the club, hey, you might be okay, right? But what about Nana?
Absolutely.
What about your friends, Nana?
So, people, I got a chance to meet you under some unfortunate circumstances. But for those who don't know you, Judge Clay Jenkins, residing over Dallas County. How long have you been in office?
I've been in office since 2011.
Okay. 2011. And then what's some of the duties for those who don't know what the judge do over?
So the judge is similar to a mayor. They oversee the county government as opposed to a city government. And then in times of crisis, then I oversee everybody, everything.
Right.
And we're in one of those times now.
Absolutely. And so under your tenure, 2011, 2012, the Zika virus.
Yeah.
2014, the Ebola virus.
Right.
2020, the coronavirus. What are the differences, I guess, how you all are handling between those and now? And are we prepared?
So we are prepared. The core of what we're doing doesn't change. And that is we have to stay calm and we have to follow the science. We have to be transparent with the public, and we have to rely on them to use personal responsibility and make good decisions. And we have to set the table as government for them to have their best chance to make those good decisions to protect themselves. But all of these viruses are different. And I give people the example of an emergency plan for a virus or any emergency is not like a house plan where you're building the house and no one's trying to knock it down. It's like a battle plan or a game plan in a sport where there's someone on the opposite side, in this case, a virus, that is working hard to complicate the plan. And so we have to make dozens of decisions every single day. And, they're different with each of these, but the core values of treating everyone the way that you'd want to be treated yourself and staying calm and following the science is the same for every emergency.
On a scale of 1 to 10, and 10 meaning this is complete threat and ending of humanity, how, if you was to scale the threat of coronavirus 1 to 10, what would we scale it?
It's a good question. I don't know that I have a numeric answer. I suppose my answer, Derek, would be that number is in the hands of the people that are watching your podcast and everyone out there. Because if for instance, people continue to get in large groups and it spreads to one of those groups, then suddenly we're having to monitor and isolate, say, 200 or 300 people that were in the club that night or were at the luncheon, and if that happens, that overruns our epidemiology or disease detective team's capabilities, and there's more likely for community spread. It will be catastrophic if it gets into our senior centers and nursing homes, which you're seeing out there in Seattle, where they have people that die every day. And so we're trying to keep that from happening, but whether it's, a 5 or a 10, or something in between, Derek, is up to everyone.
Okay. Although we know that the news is here to inform us and to spread the word. But how much of the news is sensationalism, and what percentage of it is truth? Because it seems like a lot of good information comes from the news, but a lot of hysteria seems to come from the news.
Well, the news is just reporting, I think, as far as this goes, they're just reporting what's out there. There's some hysteria out there. There's some people that are, for whatever reason, hoarding toilet paper, and, taking all the food out. You go to the store, my wife went to the store the other day, there's like 2 cans of tuna fish on the shelf.
Wow.
So the news isn't creating that, they're reporting on it. And that just complicates us because, this is not a hurricane, okay? There's going to be plenty of toilet paper, okay? But now, one of my calls for this week is with all the various grocery stores about dealing with supply chain issues that are not caused by people being sick in the factory. They're caused by people hoarding, products, right?
Absolutely.
And so we got first responders, for instance, right now that are out there taking care of sick people that don't, they're running low on hand sanitizer. And we've got, people that don't, in nursing homes and healthcare clinics that don't have masks because everybody in the country is hoarding those. Those masks aren't going to keep people safe out on the street. But, we need those for people who are sick so they don't breathe all over the rest of us.
Absolutely.
But we don't have them now because everybody's hoarding them.
So the understanding with the mask, from what I understand, is the mask doesn't necessarily prevent you from catching the virus. It just keeps you from whatever you have spreading to others, correct?
Yeah. There's a certain type of mask that if worn absolutely correctly, which nobody ever does, but it's outside of the healthcare community, but that can catch, microbiology and virus. But the majority of these masks, the ones that everybody is hoarding, really what those are useful for is if you have an infection and you're going to be around your family or you're going to go to the doctor's office and wait in the waiting room, you would wear one of those masks. Unfortunately, the vast majority of people have a box of them that they'll never use, that they pay 10 times too much for, in a drawer somewhere in their house. And so those out in the healthcare community, the first responder community, don't have what they need right now. I even had a call yesterday, Derek, with a distiller of spirits, a vodka manufacturer, about pulling some of their lines, if you will, their whatever they call those vats, the way they make liquor,
Okay.
and turn that into making 60% alcohol so that we could get 50-gallon drums from them and make our own hand sanitizer.
Oh, wow.
For ambulances.
Oh, that's we definitely need that because I've seen some crazy things where people were selling hand sanitizer on eBay for like astronomical prices. Yeah. Recently, Dallas County was placed under some restrictions. Can you educate us exactly what those, what are we able to do and what we encourage not to do right now?
Sure. So let's talk about what you can't do. You can't meet in groups of 500 or more. If we find out that a group, like a club, for instance, has had over 500 there, then that club will be cited and the persons responsible will be subject to up to a $2,500 fine and up to 6 months in jail. So you can't do that. But that doesn't mean that when you get 400 people in the club or 400 people in the sanctuary, that there's not a risk there. We are strongly discouraging. I have not outlawed it yet. I have the ability in these emergency situations to pass rules that are punishable by fine or jail. But I have not outlawed large gatherings under 500, but we're strongly discouraging any gathering above 250. And if you're over 60 years of age or you have an underlying condition, we're encouraging you in the strongest way possible to limit meetings to 10 people or less. And I'll tell you, why that is, Derek. There's a 15% mortality rate, so 15 deaths out of 100 people for folks over 80.
Wow.
That goes down to 6.5 out of 100, or I guess they know half death, so 7 out of 100. If it is people in their 70s, and it's still 3.5% or 4 out of 100 for people in their 60s. If someone is a survivor of heart disease, like they've had a heart attack or a bypass, it's 1 out of 10. If they have diabetes, it's 7 out of 100. So it's a very serious thing for a broad part of our population. And what I would say for our young people is it's not outlawed that you go to a big party with 100 people, but the price for you going to the club or for you going to a lunch with 100 people, ladies who lunch, it may be an incredibly high price that is paid by our nanas, and your friend's nana,
Right.
your grandpa, your parents. So, I would just encourage people, don't just look after yourself. Look after the community and the people that you love and the people that you care about, the people they love. By the way, just because you're young, if you're a 17-year-old athlete, okay, it's still twice as deadly as the flu.
Wow.
Okay, so the coronavirus is nothing to play with. Of the 12 people that we currently are monitoring now, we've had 14 cases, 2 of them recovered. One of them had to be hospitalized, it did recover. But over half the ones that we've diagnosed that are still under doctor's care are in the hospital. It's a pretty serious illness that whether you're 60 years old or 16 years old or any other age, you want to avoid.
So how should we go out other than the club? But like, what about the normal day to day? Going to the supermarket, going to the mall, going out to dinner or lunch or brunch with our friends. Like, how should that?
Sure. So Derek, everything carries a risk, and we've all got to make our own decisions. But for instance, probably the safest way to feed yourself is to go to the grocery store, and it is safe to go to the grocery store. Just try to keep good social distancing, 6 foot from other people, and get your own food and cook it yourself. So there's only 1 or 2 people, touching your food, working in your food. If you get takeout, then you're not in a dining room, but you still probably have 10 or 15 people in the kitchen touching your food. If you go to a restaurant, the smaller the dining room, the better, because if you go to like Highland Park Cafeteria or Furs Cafeteria,
Right.
Everybody's walking by the food, and then they're all sitting in a great big room eating the food. And I'm not, saying any of those places should shut down. We're not shutting restaurants right now, but just all things being equal, the person who made dinner for their family at home is around a lot less chances for exposure than the person who goes to the restaurant. If we're thinking of activities to do with our family or for ourselves, a walk around the neighborhood, anything outside, go to the zoo, go to the look at the flowers, the spring flowers, what's that, arboretum,
Yep.
Things like that. Go take a walk down one of the many trails that we have. The air dissipates and moves around quite a bit there. Viruses don't do well in sunlight like they do, inside your home or in a building, a restaurant, what have you. So that's a safe thing to do. And less is more. The less the crowd, the better. And really how we act over the next 10 days or so is going to set the table for how big this thing blows up.
Wow. Okay. So we in a very important zone right now.
Yeah, a very important zone. So like last week, or 2 weeks ago, we became the first county and the first place in the state of Texas that could even perform any test on this virus. And last week, we had the capability to perform like 35 tests a day or something like that.
Okay.
Next week, we'll have the capability to perform, by the end of the week, I hope, like 10,000 tests.
Wow, that's what
Okay.
we need.
So you acting responsibly gives those of us who are in the hot seat trying to keep you safe the time, and gives the pharmaceutical companies, everyone the opportunity to catch up to this virus, and together we can get it under control. If people don't act responsibly and they're like, hey, I don't know anybody that's got that virus, and they're just making a big deal out of this for nothing. And they keep doing, they keep going to large group gatherings, they end up getting sick, they give it to 10 or 20 people. It'll get out of control, and we'll have a lot of people in the hospital. It'll overrun our hospitals, and we'll have people that can't get the care that they need.
Can you break down social spacing and exactly what that is so people have a clear understanding of what they should be doing?
Yeah. So whenever possible, 6 feet is the ideal. You know, 3 feet is you know, within 3 feet is pretty safe, right? But for instance, let's say you work in a place where you all sit around kind of a bullpen where all the desks look at each other. You know, you might want to rethink that. Businesses and people that can, you know, people that are contractors might think about, could they telecommute, right?
Right.
Do I really need to go to that meeting?